Hi, my name is Egon Euwe. I'm based in Italy, where my main focus in my clinic is aesthetic dentistry. So I'm just about to be interviewed by an oral surgeon and a clinician at the same time, so I'm a bit nervous, to tell you the truth. Very good question, and I think, you know, a fast job does not match so well with the highest level of an aesthetic work as we like to see it ourselves. So it's a problem, because if you want to go step by step following the principle of backward planning, you want to test drive the solutions. We work, for instance, a lot with provisionals, and unless they are looking very nicely, till they are looking very nicely, we won't move forward. So we need all the time, also biologically, to have stable tissues around our implant-supported provisionals in order to be able to finish the job. Because our material of first choice has become zirconia-based ceramic artwork, and the layering of the ceramic only is done in a millimeter and a half of space. So that already shows you how precise we have to be, not only with the implant placement, but also in repositioning the tooth in a mouth. Otherwise, we cannot correct in the end if we don't do the work up front. Well, I think that's a very good question of a technician. I think we have more freedom with implants, because we really can position the teeth ideally in the space of the mouth and the face also. So, and the limitation of natural dentition is that you are working on a root. So you can do orthodontics, but that also has limitations. So I prefer to play with implants, to be honest. Yeah, I think it's again a very good question, because our ideas as coming out of the profession about aesthetics are slightly different than the ideas the population has about aesthetics. Like fast dentistry, a little bit in the all-on-4 style, where you see treatments started and finished within a week of time, or even less. That is satisfying a big portion of the average population, but we see huge margins of improvement in many of these treatments. So I think an important part of our work is to educate our own patients before we start doing what we like most. And then you try to find synergy somewhere in the middle. I don't know if that's a satisfying answer, but it's a little bit my philosophy. I try to run the show myself, but together with the patient after I inform them. Well, I think every product has his target. Especially in Europe, where I'm working, we see that the population sort of splits up in a small group of patients who is looking for high-end products. So there is where you pull out all the tricks and you deliver the best possible ceramic artwork, I would say, placed on implants with almost no limitations. Whereas an important part, let's say the middle class of the population, they are losing out some of the financial possibilities, so they will go shopping more for the straightforward, more basic products, and that is where acrylic still has a place to be applied, I think. Different price tags, different solutions, different treatment times, different expectations from different groups of patients. Yeah, nice question, because I think it all starts with a proper diagnosis. We know that after tooth loss, we lose volume of the tissues. That's both bone and soft tissue. So if we are fast enough, or if we have a starting point which has an abundance of tissue, we can go for what I call the preservation strategy. If we wait longer, or we starting with patients with very thin biotypes, or simply because the patient has lost too many teeth, too many structures like papilla, we sometimes go for the replacement or the reconstruction. So these are the three options: preservation, reconstruction, and replacement. Replacement, I mean, we will be working, we are forced to work with a pink prosthetic design in these cases. And option number 4 is a combination of these three. Yeah, well, that's of course difficult sometimes to decide when to move to a pink prosthetic design and when to rebuild the same architecture with the tissues of the patients. Of course, we have limitations in rebuilding papilla or certain volumes that we need to have lip support. So I think the sooner you can decide on that, the better it is. A way we fine-tune, for instance, our final restorations, if we are still not sure if the patient needs a pink prosthetic design, what we do is we make a gingival mock-up, which we place on top of the fixed provisional, where we have teeth only. And then we can see directly in the mouth of the patient if the patient looks better with the papilla, if the proportions of the teeth become better because we have more control adding a pink part. And also the way a lip moves up along an interface which is inclined when we make teeth that look like bananas might be a dynamic facial problem that needs to be tested before you make the final restorations. What can be tricky is when the interface between the porcelain gingiva and the real gingiva is within the visible smile line. So that should be avoided. And the sooner you see that, preferably before you do the surgery, the better. Because then you can maybe reduce a little bit of the bone and go from start for the pink prosthetic design. But that's not always possible, and sometimes we have to make that the specific decision at the end. Pink porcelain design requires also a different way of cleaning for the patient. So that's for the laboratory part important. We don't like concave surface facing the interface of the real gingiva with the patient. It should be flat or concave. So, and there should be an entrance point for dental floss. So all these elements are pieces of the puzzle. The problem, first of all, is I have to find the time. But I prefer to do sports in the weekends. Outdoor, I like to go mountain biking and windsurfing. That are my main hobbies. In the winter we do some cross-country skiing. And besides that, I'm really captured by going every year on different types of safaris, exploring the remote corners of Africa, in my 4x4 vehicle and making pictures of wildlife and landscape. So that's my my favorite way to kill some time.